Hi everybody, today I am going to discuss the most common surgical emergency which we encounter in our clinical practice. I am talking about appendicitis, which is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves. As inflammation worsens, appendicitis pain typically increases and eventually becomes severe. Although anyone can develop appendicitis, most often it occurs in people between the ages of 10 and 30. Standard treatment is surgical removal of the appendix. Now let me tell you the symptoms. Signs and symptoms of appendicitis may include sudden pain that begins on the right side of the lower abdomen. It could be sudden pain that begins around your navel and often shifts to your lower right abdomen. Another presentation is that pain that worsens if you cough, walk, or make other jarring movements. Nausea and vomiting, loss of appetite, low-grade fever that may worsen as the illness progresses, constipation or diarrhea, abdominal bloating, flatulence. The site of your pain may vary depending on your age and position of your appendix. When you are pregnant, the pain may seem to come from your upper abdomen because your appendix is higher during pregnancy. Make an appointment with the doctor if your child has worrisome signs or symptoms. Severe abdominal pain requires immediate medical attention. Now let me tell you the causes. A blockage in the lining of the appendix that results in infection is the likely cause of appendicitis. The bacteria multiply rapidly, causing the appendix to become inflamed, swollen, and filled with pus. If not treated promptly, the appendix can rupture. Now I'll tell you the complications. Appendicitis can cause serious complications such as a ruptured appendix. A rupture spreads infections throughout your abdomen, which is known as peritonitis, possibly life-threatening condition. This condition requires immediate surgery to remove the appendix and clean your abdominal cavity. The second common complication is that a pocket of pus that forms in the abdomen. If your appendix bursts, you may develop a pocket infection, that is abscess. In most cases, a surgeon drains the abscess by placing a tube through your abdominal wall into the abscess. The tube is left in place for about 2 weeks, and you are given antibiotics to clear the infection. Once the infection is clear, you will have surgery to remove the appendix. In some cases, the abscess is drained and the appendix is removed immediately. Now let me tell you the diagnosis of appendicitis. To help diagnose appendicitis, your doctor will likely take a history of your signs and symptoms and examine your abdomen. Tests and procedures used to diagnose appendicitis include physical exam to assess your pain. When patients come to us, we may apply gentle pressure on the painful area. When the pressure is suddenly released, appendicitis pain will often feel worse, signaling that the adjacent peritoneum is inflamed. Also, your doctor may look for the abdominal rigidity and a tendency for you to stiffen your abdominal muscles in response to pressure over the inflamed appendix, that is known as guarding. Your doctor may use a lubricated gloved finger to examine your lower rectum, that is known as digital rectal exam, and that can also detect inflammation of the appendix. Women of childbearing age may be given a pelvic exam to check for possible gynecological problems that could be causing the pain. Blood test. This allows your doctor to check for a high white blood cell count, which may indicate an infection. Urine test. Your doctor may want you to have a urinalysis to make sure that a urinary tract infection or a kidney stone is not causing your pain. We may also order some imaging tests. Your doctor may also recommend an abdominal X-ray, an abdominal ultrasound, computerized tomography, that is CT, scan, or magnetic resonance imaging, that is MRI, to help confirm appendicitis or find other causes for your pain. Now let me tell you the treatment. Appendicitis treatment usually involves surgery to remove the inflamed appendix. Before surgery, you may be given a dose of antibiotics to treat infection. Surgery to remove the appendix is known as appendectomy or appendicectomy. Appendectomy can be performed as open surgery using one abdominal incision about 2 to 4 inches, that is 5 to 10 centimeters long, which is known as laparotomy. Or the surgery can be done through a few small abdominal incisions, which is known as laparoscopic surgery, which is most common surgery done nowadays. During a laparoscopic appendectomy, the surgeon inserts special surgical tools and a video camera into your abdomen to remove your appendix. In general, laparoscopic surgery allows you to recover faster and heal with less pain and scarring. It may be better for older adults and people with obesity. But laparoscopic surgery is not appropriate for everyone. If your appendix has ruptured and infection has spread beyond the appendix, or you have an abscess, you may need an open appendectomy, which allows your surgeon to clean the abdominal cavity. Expect to spend 1 or 2 days in the hospital after your appendectomy. If your appendix has burst and an abscess has formed around it, the abscess may be drained by placing a tube through your skin into the abscess. Appendectomy can be performed several weeks later after controlling the infections. Now, after appendectomy, I should tell you some lifestyle and home remedies. Expect a few weeks of recovery from an appendectomy or longer if your appendix burst. To help your body heal, you should avoid strenuous activity at first. If your appendectomy was done laparoscopically, limit your activity for 3 to 5 days. If you had an open appendectomy, limit your activity for 10 to 14 days. Always ask your doctor about limitations on your activity and when you can resume normal activities after surgery. Also, you should support your abdomen when you cough. Place a pillow over your abdomen and apply pressure before you cough, laugh, or move to help reduce pain. Call your doctor if your pain medications are not helping. Being in pain puts extra stress on your body and slows the healing process. If you are still in pain despite your pain medication, you should call your doctor. Get up and move when you are ready. Start slowly and increase your activity as you feel up to it. Start with short walks. Sleep when tired. As your body heals, you may find that you feel sleepier than usual. Take it easy and rest when you need to. Discuss returning to work or school with your doctor. You can return to work when you feel up to it. Children may be able to return to school less than a week after surgery. They should wait 2 to 4 weeks to resume strenuous activities such as gym classes or sports. Now I should talk a little bit about alternative medicine. Your doctor will prescribe medication to help you control your pain after your appendectomy. Some complementary and alternative treatments when used with your medications can help control pain. You should ask your doctor about safe options such as distracting activities, such as listening to music and talking with friends. Well, on my channel Hobbit BB, there is a separate playlist for music therapy, and that is very relaxing, so you can watch those music videos on this playlist of music therapy on my channel Hobbit BB. So I was talking about that you can do distracting activities such as listening to music and talking with your friends that can take your mind off your pain. Distraction can be especially effective with children. Another option is that you can use this guided imagery such as closing your eyes and thinking about a favorite place. Well, I hope you like this video of mine about this most common surgical emergency, that is appendicitis, which I just discussed. if you have any problem like other illnesses, you can post comments in the comment section of this video and other videos on my channel, and I'll try to make a video on your illness. If I don't find a time to make a video, I'll try to reply to your comments as soon as possible, because almost all of comments are replied by me whenever I am online. Okay. Until now, if you haven't subscribed my channel, please subscribe my channel and click the bell icon so that all upcoming videos are delivered to your inbox straight away, and select the all option for incoming videos. Okay. And if you think that my video provides some sort of benefit, even if it is little benefit, then please give a thumbs up to this video, and do not forget to share my videos with your family and friends and through social media such as Facebook and Twitter, because my channel with BB is basically meant to serve humanity across the world. So by sharing my video, you can also be part of this great initiative. Thank you very much for watching this video. See you in next video. Bye for now.